Bienvenidos, Latino community.
Welcome back. Today we're going to be talking about suicide prevention and suicide awareness. We've been talking about depression for 2 weeks, so we just definitely want to give you guys a little heads up and information on the extremes of depression, which is suicide ideation, suicide attempts,
Suicide thoughts.
suicidal thoughts, yes.
Yeah. Definitely a heavier video, but so important to have. So we wanted to start by kind of explaining the difference between suicidal ideation and suicide planning, and suicide thoughts. So for you, what would be the differences?
So suicidal thoughts, I feel, come from desperation, from being upset with your life situation, that you're just thinking, you know what, I just wish this could end.
Right.
And you maybe have a thought about killing yourself, but it's not, it's more fleeing.
Yeah, I think that's a really good word. For me, it's the suicidal ideation and the thoughts are fleeing. I think sometimes people think, oh, I wonder what it would be like for me not to be here. What would my family do if I wasn't here? What would happen if I just kind of drove this car off the road, right?
You start picturing these things.
Yeah, but they still kind of have this fleeting aspect of you have this thought and it just kind of goes away. So when I work with this with clients, the assessment, I really make a point. Are they fleeing? Are they staying with you? Like, how in advance are we with these thoughts? And so I think the planning, and the action starts, I think, when the thoughts remain a little bit longer, and you start to sit with them a little bit longer,
Right.
And then you start thinking, oh, what can I do? What action can I take towards this?
So part of my assessment for that, when we're talking about suicide ideation, yes, it is like starting to picture, right? But so easily you would come right back. And sometimes I even ask, are you scared of the thoughts? Because if they're scared of the thoughts, then for me, I'm like, okay, we're not in the danger zone right now, because you still see that as an outrageous possibility for you.
Yeah.
But your life is so that you even thought about it. And that, we get that. But you're afraid of it, so you come right back and you're like, nope, that's not going to happen. What you're talking about is the planning, and that's when they're not afraid.
Yeah.
That's when they're like,
They're
what would it look
seriously
like? Well, how would I do it?
They're seriously thinking about it at that point, right? Of now it's a vision. It's not a thought anymore. Now it's let's vision how it would work and what it will look like.
Right. And I don't know about your assessment, but I usually ask, like, well, do you know how you would do it? Do you have the means to do it?
Yeah.
So if you're thinking about overdosing, have you thought about the type? How? Do you have access? Who have you reached out to? Yeah. I start thinking and asking all of those questions, and that's when we, at least for me, I will mark it as really high risk.
For sure. I think the moment people have a plan and they can share, this is the way I have thought about it, that does spark a red flag for me of, okay, and if possible, let's create a safety plan. Let's get together and really help you as you kind of process these thoughts and, this planning, right? And I think then it's really important every session. How are the suicidal thoughts?
Right.
Have you had any planning yet? Have you acted in any way? And so that I think it's really complicated too, because I'm thinking of self-harm.
Right.
And I think self-harm doesn't always mean suicide.
Right, absolutely.
And I think that's where, a question like yours is really important of like, are you scared, right? Is this something that you want? something that I ask is, well, you don't want to be here and you're hurting yourself. Is it because you don't want to live anymore, or is it because you're just not liking the way life is now and you
Right.
wish, life looked different? Because those are two very different things, right?
Right.
And I think when it's to the suicide point is they don't want to live anymore.
Mm-hmm.
And differentiating that is really, really important in this.
Right. Something that came up for me as you were saying that, it's that will to make changes,
Mm-hmm.
right? So yes, I don't like my life right now and I'm upset and I hate the way it's going, but then there's like a 5% window of I want it to be different.
Yeah.
Therefore, for me, I'm like, so you're willing to make some differences and create something versus like, at this point, I don't even care if it's better.
Mm-hmm.
It's completely done, hopeless, like we're done.
Yeah.
That's when it's you have to take it a lot more seriously. But the fact that you brought up self-harm,
Mm-hmm.
I'm thinking for parents, right? We see this in teens all the time.
Yep.
And you're thinking, you're afraid. You're like, you're cutting yourself, you're hurting yourself, like you're obviously suicidal.
Right.
And that doesn't necessarily mean that, right?
Mm-hmm.
There has to be like a progression. I feel like it's on the spectrum.
Yeah, for sure.
So there's still hope. There's still opportunity to really get that kid help and make sure you come and you become that support system for them.
Yeah, I think really asking how come the self-harm is happening.
Mm-hmm.
What is the reason? And again, I think understanding, is it because I'm in pain and I'm coping through that pain and I just don't really like my life right now, I'm really sad,
Right.
I want to get distracted from this other pain? Or is it that, your child or your loved one doesn't want to be here anymore?
Mm-hmm.
Because then we were just talking about, well, who commits suicide? And we were talking about the really sad reality that 9-year-olds, 10-year-olds
Right.
are committed suicide too.
Right.
It's not just adults.
Right. Yeah, there's not a specific reason for it anymore, right?
Or age range.
Age range. I know we were looking at statistics and the highest rate of suicide is actually an 85-year-old
Yeah.
white male.
Yeah.
But they have the biggest success in suicide, at least. But men in general
Mm-hmm.
commit 80% of the suicides.
Yeah.
Isn't that astounding number? Although women are the ones that attempt the most,
Mm-hmm.
but men are the ones that actually
Are more successful.
at
complete
it. Yes, 80% of it.
That's a big number.
Right. I just thought like, wow. And I know that the suicide rates for teens are going up, especially after COVID and especially with social media bullying and all the cyberbullying and everything. So it's something so important to be aware of, right?
Absolutely. So what do you think are maybe some risk factors that contribute to someone with suicidal thoughts or even completing suicide? What makes someone at risk?
I think isolation. Depression, right? I think that if you don't have a good social network or community or family support, I think that is a huge risk factor.
Right. I think even targeted ethnic groups or even communities experience, like the heavy racism, and with men, right, the culture of, men don't talk, men are not weak, men should not cry, and what that does to someone,
right,
and the pain they have to keep inside. And then it is rising with LGBTQ community, Latinos and youth. That is, we're seeing a lot more, and so that is definitely also a targeted group that doesn't feel like they can be themselves, or they don't have the support, they don't have the protection that they need.
Right, which leads to hopelessness.
Yeah.
Right? They're like, well, if no one's here to support me or help me or care, then what's the point?
And then the bullying stories we hear with little kids. And maybe they're not telling their parents, and they're also carrying that heavy weight for someone their age, and the loneliness, like you said, and that lack of community and support, and doing it all alone.
I know, for those little guys.
Yeah.
You know, something interesting that we found was that Hispanics, like you said, don't have the highest suicide rate. I think it's about 8 to 9% of the overall. But we do have the highest, or not the highest, but a very high percentage of suicide ideation.
Yeah.
And I thought, when I heard that, I thought, you know what, that makes a lot of sense. Because we don't talk about it. We internalize everything.
Yeah.
And it's just not socially acceptable or culturally acceptable to do those things. And I know we had conversation like, what do we think it is, right?
Yeah.
What are some of those protective factors that you see in your assessment, or you kind of are listening out for?
Yeah. So I think something that really has helped our community in that way, I think, is religion, like we were talking about. There's this connection to God, and there's this beautiful connection of faith, and it will get better. Let's pray. You know, there's gonna be this one day where it's gonna get better. Almost like this hope of it will be better. Like death doesn't have to be the end. I think that really helps our community a lot get through hard times. And you know, we've talked about this before about how our culture is very it's not singular, it's not very kind of independent like the American culture.
We're a collectivist culture.
We're collectivist, and so with that comes almost this duty to our family of we can't leave our families.
Right.
And so I do think that's this factor of, you know, almost like there will be too much guilt, you know, if something happens, and, you know, the familism that our culture has.
Right.
It's such a strength that, you know, research shows that that's also a big factor about what really helps our community in this arena.
Yeah. I was thinking of the clinical list, right?
Okay.
And I'm thinking, okay, so we check off, like, do they have faith? Do they believe in something?
Yeah.
Okay, sure. Like, if it's strong, if it's light, whatever, but is there faith? Is there community? Do they belong to social groups? Do they have social interest, right? So some of those things clinically make sense, but then when you apply it to what you were saying culturally, I'm like, okay, so belonging to a social group, familiarismo, that is the strongest, right?
Yes.
Faith, even if our younger generations are not following in the traditional way, there's still this slight element of faith or something greater than themselves that offers that hope when you are in very deep places like that. So I'm just thinking, I'm like, it just equals out to like social interest, right? Sometimes because we bond culturally, you feel like you're a part of something greater. So although you feel isolated, especially in this depression and this like suicide ideation, you still belong, right? And I think that maybe that resonates at some point, and that's kind of what protects our community from suicidal rates. And I would just be so curious to know, like, what happens to the 8 to 9% that we, you know.
Something that I was thinking about that could also, and this is not, you know, I don't have any statistics on this. I wonder if the stigma almost helps too. Of suicide, because suicide is very stigmatized.
Right.
You know, there's a lot of mixed emotions when it comes to suicide, and I wonder if that affects our culture in doing it.
Yeah.
Because, you know, it doesn't save so the statistics are lower in Hispanics, but there doesn't mean there's no Hispanics that haven't committed suicide, because there is.
Right.
And so it's like, oh my God, like what happens to them? And so I think it would be really nice for us to talk about what are some signs for suicide, and how could we have suicide prevention that could, so our community even knows that it could impact us too, and what to look for.
Right, instead of ignoring it, right, or like it doesn't plague us, or it's not that bad. Like 8 to 9% of the population of suicide, it is big. It's a huge deal.
Yes.
So any reduction would be helpful.
Absolutely. And I think sometimes there are no signs. It does take people by surprise.
Those are probably the scariest ones.
Absolutely. Yeah. Of like, yes, I knew this person kind of struggled, but I didn't know they struggled that bad. And I think that's the scary part about suicide. It's, you know, we look at people that looked really happy, like Robin Williams. Right. And, you know, they're smiling, and people that we just never imagined the pain that they were in, that they decided that it's time for my life to end. And I think that is something that we could say is, no one looks suicidal. It doesn't really appear.
Yeah. As you were saying that, an image of a friend's sister came in mind, and she was gorgeous, beautiful, and every picture or every interaction you'd see, she was just extremely happy. And I'm thinking of her, and I'm just like, you're right. I didn't know her personally that close, so I don't know if there were signs or not. But it makes me think, even like as a therapist, I'm like, what happened in her life? There was something that must have happened that led her to this option, you know? And it didn't matter of the protective factors at that point, because I know for a fact she had a lot of the things that we just listed. But it must have been that intense. And I wonder if she just if she didn't want to tell anybody, or, you know, no one was aware that this was going on. And it just brings me back to like how important it is to go to therapy. Like even if your family doesn't understand, or you think that they don't understand, or, you know, you feel like friends don't get it, or no one, whatever happened to you is so stigmatizing that you don't even want to verbalize it. Ask for help, even if it's in private, confidential setting, you know, someone will be able to help.
And I think also checking in with loved ones. We can't make someone decide not to, right? I think that's the difficult thing to kind of grasp. I think when people have decided, you know, they have decided. But you never know, you know, it could be, you know, this one thing really clicks something for them, and they're like, you know what, you know, let's not today. And the importance of checking in, even with people that appear happy. Like, how's it going? Do you need help? There's a lot of people that suffer in silence, and I think it's for different reasons. They feel like they can't share, or a very common one is they don't want to inconvenience people. I don't want to worry my loved ones. I'm just going to keep it in. And just normalizing those conversations, like about mental health, like how is your mental health? How are you doing?
When you ask, how are you doing? Like, how are you doing? I'm thinking like when you're othered, you know, when you live in a community that you're probably the only one, you know, and you feel like these people probably don't get it. You never know. Maybe they do. And maybe if they don't, they will still be kind souls that they will try to understand and still connect, you know?
Absolutely.
At the end of the day, we're all just humans.
So I guess I was thinking of, so sometimes, like we mentioned, it's sudden, like there's no signs. But I'm wondering about the times that there are signs. So I think it would be good to explain what are some signs. And what's coming up for me is I think when they start selling things, like all of their belongings, like they're kind of getting rid of things. I think if there's a history of attempts,
Right.
I think that increases the risk for someone of, okay, like, how are you doing? Even if the way they're talking, oh, when I'm gone, you know, this is gonna be for you,
Right.
or, you know, when I'm gone, try not to miss me so much. I think those are some signs that, you know, could be telling.
Right.
I'm wondering if you have any that you can think of, or anyone crossed your
The
mind.
one thing that crossed my mind was disassociating. I feel like that's kind of a flag for me to check in and say, like, babe, what's going on? You're here, but you're not here, you know?
Yeah.
And I think the communication, like what you were saying, it doesn't necessarily have to be so obvious of like when I'm not here, but it may just be like, you know, we're talking about plans. You're like, oh, well, I don't know. Maybe, you know, who knows if we get to that, or kind of like leaving themselves out of plans. It's very slight, and you can't worry about all of your friends that say things like that, but when you start putting a lot of those pieces together, it'll make sense.
Yeah, for sure. What else do you think would be really important for us to talk about in this episode? Suicide prevention.
I think that when you start having suicidal thoughts, even in the very beginning, it would be helpful to go get help. Absolutely. Or to talk to friends, or to talk to your faith group or family or whoever. I think it's important to talk right from the beginning. I think that it's about taking action right away. What do you think?
I think so, that they can talk to someone about it. And I think something worth mentioning is, let's say someone talks to whoever's listening to this, someone's bringing, oh, I feel suicidal to them. I think it's really important to really validate and really not dismiss that.
Right.
Or to not make the person feel judged. And I know this is such a hard thing to understand, because again, there's a stigma, right? You hear a lot of, you know, that person, you know, left their family. Oh, how could this person do this to their loved ones? Oh, that person was weak. Really destructive narratives, right? And I think it comes from really not understanding what that place is and what that means and what that does to someone. You know, I don't think anyone does that lightly.
Right.
You know, even if it's like sudden, it wasn't sudden.
It was not sudden.
Right. No. You know, it appeared sudden, but there was some deep thinking and deep planning on how that was going to happen. And I think just recognizing the complexity of this.
Right.
And encouraging this person, you know, to get some help, to talk to someone.
Right. And that makes me think, like, it doesn't necessarily have to mean that you're going to be that person to help.
Correct.
I think it's a huge weight for somebody that is maybe not equipped for that. I think that knowing that you're the support and that's your role, you're the friend or the family member that is just going to love them and is just going to say, I want you here because I love you. And that's it. Like, your decisions are your decisions. There's no judgment. I just really want you to be part of my life, you know, and just knowing that they are wanted, that they are seen, that they are valued. I think that goes so far. So not that you have to go into therapist mode, or you have to be the psychologist, or, you know, the priest or anything. Like, you know your role, because yours is probably way more important than the therapist. Like, that social group, that social support, that family support is a lot heavier than anybody outside of that.
Yeah, absolutely. I think that's a really good point. Like, it shouldn't be solely on someone.
Right.
They could assist, be part of the community, but it should just never be on one person.
Right. Like, you have to be the one to keep them from doing this. That's probably an impossible task.
Yeah. So maybe something that our community can learn maybe is to ask more questions about how someone may have done that, even if they disagree, even if it goes against like our cultural values of, duty, family, religion. What gets someone to do that? And I think being open-minded about that, just to increase awareness of it, that it does happen even if in our community. And what can, as a collective, how could we assist, people?
Right. Yeah, just be there for people. Just support and love them, right?
Yeah, and how could we be mindful of the groups that, are at higher risk? How could we support those groups? Is it the way, could we change our approach, how we handle something, what we say, our words, or how we treat people?
Yeah, I mean, I was thinking that for the kids and the bullying, right?
Yeah.
I'm like, can we please just all practice and teach our kids, like, be kind and look at your classmates and see, like, maybe somebody is on their own, and just take that chance and be a good human being and just say, like, you can have lunch with us, or just it's like those little small things. Even a smile down the hall, like, teach your kid, you're not better than anyone, and no one is better than you, and just be kind. Yeah.
So we did want to leave you guys with some numbers. We're gonna do phone numbers and then text numbers, so they are suicide prevention lines. So the nationwide number is 1-800-273-8255. That's the English line, and the Spanish line is 1-888-628-9454.
And if it's an emergency and you need to text right away, just text 988, and this is a national number where people can, it's a crisis hotline, so people will respond right away.
Yeah. Thank you so much for tuning in.
We'll see you guys next time.